What's up, Outworkers? In this episode, I spoke with Dr. Ira Rashbaum from NYU Langone Health. He's a leading expert on Tension Myoneural Syndrome and mind-body disorders, and a man who has had a profound impact on my life personally. Dr. Rashbaum shares his journey of discovering TMS while working alongside Dr. John Sarno and carrying on Dr. Sarno's groundbreaking work after his retirement. We delve into the physical, mental, and emotional components of TMS, addressing common misconceptions and skepticism surrounding the condition. Dr. Rashbaum also provides insights into his approach to diagnosis and treatment, drawing from his traditional medical background and extensive experience helping patients. Prepare for an eye-opening discussion that challenges conventional beliefs about chronic pain. Dr. Rashbaum, welcome to the Outworker.
Great to be here with you.
I knew when I started this podcast, you were one of the main people that I wanted to have on. I mean, your work has had a profound impact on my life, and I can't thank you enough. And I know that a lot of people could also benefit from your work, so I knew I needed to have you on the show.
Great.
So the first, I want to dive into all of your work and sort of your background and everything.
Yeah.
But before we get into that, I think it would just be good to lay the groundwork. Can you sort of just give listeners background info on what are mind-body disorders, and then more specifically, what is TMS?
So mind-body disorders is a physical pain issue that basically do with unconscious emotions like anger, rage, sadness, fear, shame, guilt. And TMS is basically tension myoneural syndrome is a syndrome, medical syndrome associated with pain, numbness, tingling, actual weakness. That's been the distraction from the brain.
Yeah, I think the thing that gets lost in the shadows of TMS is that there is a big physical component to it. I feel like when I first started learning about TMS, or when you hear about mind body disorders, the thing that gets correlated with it, and it's a false narrative, is, oh, it's just all in your head. Like, that's the only problem.
I can't stand that.
Yeah, I'm the exact same way with you.
So basically with the Medscape interview, so basically I'm very, again, sorry Medscape, sorry Mies, it's all in your head. It's really not all in your head.
Can you talk about how you first got connected with Dr. Sarno, John Sarno, and his work on TMS, and how things started there?
Right. So in 1991, when I was the second year resident at physical medicine rehabilitation at the Rusk Institute, now Rusk Rehabilitation, I was a big on call. So basically every like fourth or fifth nights I'm on call. So basically the call room is on the sixth floor. Basically most nights you don't go to sleep on the fourth on call night. So on the fourth floor to the sixth floor, serendipitously, there was a very group of patients who went up to the sixth floor who talked about Dr. Sarno. So again, very well-known people. I can't say who it is. So it's very exciting. So again, so the NYU bookstore in the good old days was at the hospital. So we talked about mind over back pain and healing back pain. And I mustered up the courage to ask Dr. Sarno for a meeting, and he agreed to see patients with me. I decided to spend a few hours a day with Dr. Sarno. So in the last year of residency, there's elective, was like 3 months. So basically, I spent 1 month with Dr. Sarno for the last year of residency. So I decided to forego a fellowship at the Texas Back Institute. Texas Back Institute was also Richard Geyer. So Richard Geyer was the last patient who did back surgery on Tiger Woods. So last weekend at the Genesis Invitational, he stopped with back spasms and also influenza. So again, very exciting. So again, I decided to take a pass at the Texas Back Institute Spine Care Fellowship to work with Dr. Sarno. So that's it.
Interesting. So,
Yeah.
I was looking into your history, and I saw that you gave a talk a few years back, and you said that you had an internship in surgery the year right after medical school. Um, can you talk to me what that process was like, having that internship, in a different field, more related with surgery, and sort of how that shaped your medical profession moving forward?
Great. So I did an internship in general surgery. So I see I wanted to be a surgeon, but I liked it, but not loved it. So one of my medical school colleagues liked physical medicine rehabilitation or physiatry. So back in the day, um, so residency programs were out of the match. So basically, I went down to my chairman Thursday night, and basically most of the residency programs in PM&R, physical medicine rehabilitation, was out of the match. So I interviewed at NYU, Columbia, Mount Sinai, Albert Einstein, and Downstate. I loved NYU the best. When NYU offered the residency slot, I accepted. So that's good.
And I heard you talk about Dr. Hubert Razumoff and Dr. Alf Nachemson, and sort of how they acted as confirmation to honestly invest sort of your life's work into this line of work with mind body disorders. Can you talk about how they had an impact on your work?
Definitely. So interestingly, I saw Dr. Hubert Razumoff lecture at the Union Del Mar in 1991 because my residency director, who interviewed me, asked me to assist with the lecture he was doing for neck pain and back pain. Dr. Razumoff, a former neurosurgery chairperson at University of Miami Miller School of Medicine, said that only 1% of his patients were appropriate for surgical treatment. So posthumously he was the Razumoff Visitor at the University of Miami School of Medicine. So I saw Alf Nachemson lecture at least 3 times, but at the NYU Grossman School of Medicine in 1996 at the Farkas Auditorium, now the Murphy Auditorium, before the departments of orthopedic surgery, neurosurgery, neurology, and rehab medicine. Dr. Nachemson said that you surgeons operate on the spine in this country with no justifications whatsoever. No one responded. I don't know why, because I'm a general surgery intern. Surgeons are alpha dogs. So again, so Alf Nachemson looked like Arnold Schwarzenegger. So if one of the surgeons made the mistake of reaching out to Alf Nachemson, he'd basically humiliate him in front of his or her colleagues. So again, Dr. Nachemson and Dr. Razumoff were the thorns in the spine of the spine care community. So as the prominent neurosurgeons throughout the role of spine surgery was like rocket fuel for me in the work with mind-body disorders.
Interesting. Very interesting. Why do you think, or where do you think it comes from? I feel like back pain has just become synonymous with the recovery process. It potentially will just lead to surgery. I feel like a lot of the time that's just where we naturally go with medicine. Where do you think that stems from?
Yeah, so my traditional medical background is a combination of medical history, symptom history, a traditional neurological musculoskeletal examination, review of the diagnostic studies, and a formulation or a diagnosis to try to take the best possible care of the patient. So the assumption that back pain often leads to surgery is from a false premise.
What's up, Outworkers? We hope you're enjoying this episode as much as we love creating it for you. If you're finding any value or inspiration in what you're hearing, we'd be incredibly grateful if you could take a moment to support us. Here's how you can do that. First, if you know someone who could benefit from the insights or thoughts we discuss, please do share our podcast with them. Word of mouth is one of the most powerful ways to help us grow. Secondly, leaving a review on your favorite podcast platform, whether it's 5 stars or a few kind words, makes a huge difference. Not only does it boost our visibility so more people can discover us, but it also gives us valuable feedback on what you enjoy and how we can improve. Thank you for being part of our journey. Your support means the world to us, and we can't wait to continue bringing you more fantastic episodes. Stay tuned and keep outworking. With my personal experience with TMS, when I first heard of your work and heard of your experience, because you had the typical medical background, it did give me more confidence
Yeah.
in sort of your line of work in TMS. How do you think your traditional medical background plays a role in shedding more light on mind body disorders like TMS when people may try to either disregard it or say that, it's kind of a sham?
That's an easy question for me to answer because the majority of my patients know of my association with Dr. Sarno. For certain patients who do not see me in association with Dr. Sarno, I ask the patients if stress can make your symptoms worse. If the patients say no, I'm a bit hesitant to go there.
When you tell
Yeah.
suffering patients that their pain is stemming from unresolved stuff in their unconscious mind, when a lot of the time people may think it's physical, what type of reactions do you get?
Yeah, so it's probably more physical, sort of like a tight, tense muscle in parts of your back and your buttock and your thigh. So for the patients who are a little bit skeptical about that, there's a page from the Journal of American Medical Association in April 24, 2013, that most of the cause of low back pain is unknown. So for the doctors who were skeptical on Thursday, I got a letter from the Department of Physical Medicine Rehabilitation at the University of Pittsburgh School of Medicine, Winter 2024 newsletter titled Useful Ideas About Chronic Axial Lumbar Pain. I can't make this up. For medications for low back pain, including acetaminophen, NSAIDs, muscle relaxants, opioids, gabapentinoids, and antidepressants, there are no evidence base for them being effective. Also, trigger point injections, um, epidural steroid injections, facet joint injections, facet radiofrequency ablations, spinal cord stimulators, nerve ablations, and medial brain nerve stimulation revealed no efficacy better than a placebo. I can't make this stuff up.
And I can 100%
Yeah,
relate to that because within my own experience,
yeah,
just giving more background on me, I did physical therapy, I did massage therapy, I did acupuncture, I did spinal decompression. I had 2 cortisone injections
yeah.
injected directly into my spine, and none of it worked.
Yeah. So also from this thing, so again, psychosocial rehabilitation, previous studies have shown that pain education for patients with chronic pain leads to lower pain intensities and greater expectations of recovery, sort of I do like my mind body back school. Behavioral therapy has significant potential for helping patients with restoring values, goal setting, and disengaging from avoidant behaviors. Yeah,
Do you know who Dr. Stuart McGill is?
I don't know.
Okay, so he's known as like a very big back doctor. He's a very structural guy when it comes to the body and back pain. And he did an interview with Peter Attia, and Dr. Stuart McGill said that he had a patient come to him who was dealing with a lot of back pain for months on end, maybe even years on end, and he had a doctor tell him, there may be a mental component to the pain that you're feeling. And Stuart McGill said that this new patient of his was incredibly offended by it and practically took it as, oh, this doctor thinks I'm crazy or that the pain is in my head. What would you say to skeptical people who may be offended or won't buy what you say?
Yes, so people who are offended is that most of these causes of low back pain is unknown, and also the biopsychosocial model of chronic pain is very, very the lay of the land.
Do you think going through failed attempts of conventional therapy can actually serve as a benefit when being introduced to TMS? Because from my own experience, I feel like if I was introduced to TMS early on in my recovery and healing process, I probably would have neglected it or thought, oh, no, this isn't possible. I'm not suffering from this. But because I had months on end of pain with no sense of healing or my pain going away from conventional stuff, I became much more open to the TMS therapy and
Yeah,
that way of healing. So, do you think that failed treatments can actually be a benefit of learning about TMS?
exactly, Tim. So basically, that sort of like in philosophy, the indirect logic type of thing. So if you're not feeling better from conventional treatments, it's probably more likely that it's probably more sort of like sort of like the mind body issue.
After Dr. Sarno retired, and then obviously, certainly after he died, How important was it for you to keep the TMS practice going and keeping it alive and present today?
Right. So after his retirement in 2012, I started seeing TMS patients in 1993. So I know how to evaluate patients and treat patients with lectures. After his retirement in 2012, I started coordinating a support group or small group meetings for patients who did not get better. So basically, I'm a little emotional. So basically, after he retired, he said, Ira, you need to start doing these small group meetings. So basically, my program is a four-part. It's very algorithmic. So basically, part one is diagnostic, confirmation, or refutation. So TMS one, not TMS zero. So part two, patients can sort of self-treat. Um, also, do my treatment program like that. Part two, therapeutic education. After patients try to self-treat, I decided to work with the patients in 3 months, and also the second lecture, also for one lecture of patients with TMS equivalents, like sort of irritable bowel syndrome, sort of like hip impingement, sort of like rotator cuff issues, and sort of patellofemoral syndrome. We decided to do this after 3 months later. So if you're not getting better, we do that small group meetings. Data is very, very good. And part four is working with sort of like a TMS therapist. It's really like psychodynamic versus cognitive behavioral therapy.
Dr. Sarno certainly went against the grain and was ahead of his time, in my opinion. Have you personally dealt with any backlash on your work or from anyone in the medical field?
Yes. So in my experience, I occasionally deal with backlash from my colleagues, but it's not as often as you think because basically at NYU Langone Health Rehabilitation, I'm sort of like the Sarno guy.
Yeah, yeah.
Right. Yeah. So again, I'm damned if I do, damned if I don't. So a very well-known spine surgeon, I can't say who it is. He's now retired. He said that physical therapy for back pain is totally baloney.
What's up, Outworkers? Are you craving more of the insights, stories, and thoughts from our podcast? Well, if that's the case, you'd love our newsletter, The Outwork 5. By subscribing to our newsletter, you'll get 5 messages every single week to help you build the relationship with yourself and motivate you to keep outworking. Signing up is quick and easy. Just head over to our website or check out the link in the show notes to join a full community of outworkers. So if you're ready to take your podcast experience to the next level and dive deeper into what we have to offer, hit that subscribe button now. We can't wait to welcome you to the newsletter crew and share even more awesome content with you. Thank you for your support as always, and keep outworking. I did physical therapy for
Yeah.
maybe three months or so,
Yeah.
and no improvements. And after 7 or 8 weeks, I believe it was, I had a checkup visit with my doctor, and he pretty much said, "All right, if you're not making any improvements here, surgery may be the best option to go." So it's just fascinating how there's such a
Yeah.
fixed path within
Yeah.
that back pain where it's like, hey, here's the process you take.
Yeah.
Don't delineate from it. You do 7 to 8 weeks of physical therapy. If that's not working for you, then maybe you just go with surgery. And then that gets into a completely new world and a lot of host of different problems.
Okay. So again, I'm not going to go there. So basically, a woman named Catherine Jacobson Raman, a Bay Area thing called a book called Crooked. The back is crooked. Another meaning of crooked. I'm going to go there.
Yeah. Um,
We'll talk about that. So basically, in March 2020, Joseph Dielman talked about in the lectures. So basically, the most expensive healthcare expenditure in 2016 was low back and neck pain, $134.5 billion. So it's a big business.
Big pharma is, as I like to say, big pharma isn't in the business of healing, they're in the business of pain management. What does the medical field, broadly speaking, what do you think it needs to change or address
Yeah.
about conditions like chronic pain?
The medical field needs to change how it feels about chronic pain from a medical model to a biopsychosocial mind body model.
You mentioned earlier when we were talking, you mentioned Tiger Woods, and that's a athlete that I'm very fascinated by. in terms of obviously he's had a lot of back issues, he's had a lot of surgeries. Other athletes like Ben Simmons who have come out with very bad back injuries, and he has also said that he's struggled with mental health issues. What are your thoughts on TMS and mind body disorders when it comes to sports and professional athletes like that?
Good question. So that's a good question. So in sports and professional athletes, the feeling is that professional athletes are perfectionists, and is more likely to have TMS than another cause because they're so perfectionistic. They're uh, so 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 it's all concerned about sort of like perfectionism. So basically, perfectionism and people pleasing is sort of the TMS personality. So again, I really can't. I take care of a fair number of professional athletes. I can't say who it is. So again, with good results.
I mean, do you think, obviously I have no idea, but do you think somebody like Tiger Woods, I mean, I think he's had 5 or 6 back surgeries. Do you think somebody like that, he may not necessarily have needed surgery and maybe the TMS sort of therapy might help him? I mean, it's kind of a difficult question to answer, but it's an interesting thing to ponder.
Yeah, but for specific like Tiger Woods, I'm really not going to go there. So sometimes my office is always open.
I mean, throughout my entire journey using conventional treatments, the mindset was always me trying to recover from an injury. I feel like that was always the terminology used, whether it was with my physical therapist
Yeah.
or people that I was talking with. It's like, oh, you have a back injury, you need to recover from this. Like I'm trying to recover from a back injury. I feel like with TMS though, and reading the book and doing your lectures, the mindset and the terminology that was always used was healing instead of recovery. What do you think the difference is between recovery and healing?
That's a good question. Recovery is getting a bit better, and healing is total return to physical and emotional function. That's the difference between recovery and healing.
Do you think that healing can mean even not even like a return, but even becoming greater of a return, even getting better? Because I feel like within my own experience, I didn't just get back to a place that I was previously, but I had gotten even better and reached a different healing level than I ever was in my life.
Yeah, I'm very proud of you. So you get to go back to total healing and also maybe greater physical functioning than what once you one of my patients once did in the past.
Getting more so into your practice and your work, um, what percentage of patients have you seen pretty much walk away completely cured or completely pain-free from the stuff that they were going through?
It's difficult to say because I only have 3 retrospective chart review data, but probably 80% of patients with a visual analog score of 7 or higher had good results within 3 months, with 81 to 100% better. I did 3 respective patient chart reviews, but in 26% of patients in 2021, I cannot help my patients because when Dr. Sarno was in practice and he ran a boutique practice, he had a pre screening phone call. Patients can make appointments with me on the patient poll called My Chart. Patients can make appointments for rheumatoid arthritis, psoriatic arthritis, osteoporotic compression fractures, chemotherapy-induced peripheral neuropathy, and severe osteoarthritis of hips and knees. And such as Dr. Razimov's data, when you are your MRI, when there are nerve root compressions on MRI and there are abnormal neurological examination findings, 1 to 2% of my patients here, I said, I can't help you. You need an operation. So, so the physical nature of TMS is a mildly decreased blood flow to certain soft tissues in the body, such as muscle and nerve, through the autonomic nervous system. For the decreased blood flow, I call it the skin response. I'm indebted to Dr. Edward Isaacs, a Richmond-based neurologist who taught me in 1992, an East Lansing musician, that a skin response is a pink reaction in a symptomatic region due to decreased blood flow.
I remember when I was in your office and you did your physical test on me, and that was one of the things that you said. You did the skin test, and I remember you told me you said how you said you see how your skin is getting all pink like this, and I said yeah, and you were like, That's TMS. And that's what I was going to when I was talking about earlier, when
Yeah.
I feel like when I explain TMS to people, or they ask, "Oh, how did you recover from your injury?" And then they said, "Oh, so like all the pain was in your head then?" And I'm like, "No, that's not how it works." And that I was saying there is a big physical component to TMS, and like you were saying,
Yeah.
with the skin test and with the deprived of oxygen,
Yeah.
there's a massive physical component.
In the American Journal of Physical Medicine Rehabilitation in February 2019 out of Belgium, patients who had myofascial pain had a change in the muscle fiber density. It's more type 2 anaerobic muscle fibers than type 1 aerobic muscle fibers. It's proven that it's a decreased blood flow. So it's true. Yeah.
I'm curious to know, because obviously you work with mind body disorders every single day, and you're very knowledgeable within this topic. Getting sort of into your own personal well-being, when it comes to your own emotional well-being and dealing with stress, is there anything specific you do to sort of stay aligned with yourself, or things that you're aware of when you have stuff going on in your life?
Absolutely. For patients with pain due to emotions, I would recommend meditation and journaling and something called box breathing that includes initials for inhaling for 4 seconds, hold that breath for 4 seconds, exhale slowly for 4 seconds. Navy SEALs do it, and a speech pathologist at work explained that to me fairly recently.
I think that was part of the reason why I felt like the healing process wasn't just a return to sort of where I was, but where I got better,
Yeah,
because I did do journaling. I did have the, as it says in the book, talk with your brain. I did have those sort of one-on-one
yeah,
therapy and meditation sessions just with myself, and they had a huge impact.
yeah.
And I also had, throughout my entire experience, after my pain was really bad, I did have a few experiences where there were small recurrences of pain, but I wasn't freaked out about it, and it almost acted like as a guide to recenter myself mentally, because it was like, oh, if I'm feeling pain, check in with myself mentally, emotionally. And I think that's also such a strong part of why the TMS treatment method is so powerful.
Yes, at the end of his career, Dr. Sun, look at your pain as a gift.
Couldn't agree with that more. I honestly, my entire mindset towards pain was turned upside down, and I started to realize, it was like, wow, pain is a gift, and pain can be used to your
Right.
advantage.
Yeah, to your advantage, just to kind of like relieve your pain and also make your quality of life much better. Yeah,
Definitely.
yeah.
What do you foresee as the next breakthroughs when it comes to understanding chronic pain and mind body disorders?
The next breakthrough in understanding chronic pain and mind body disorders is more of a perspective chart review with a higher level of pain via visual analog scale versus like a certain study, which was like the visual analog scale is 4.4. And a functional neuroimaging study to see where the anger centers are in the brain. So most of my chronic pain patients has a visual analog scale of 6 or 7. We don't really understand where the anger centers are on functional neuroimaging in the brain. So again, hopefully with my research in the next couple of years, we're going to try to figure out where the anger centers are on functional imaging fMRI in the brain. So a guy named Gary Marcus, Dr. Gary Marcus, so he was discussed in the lectures. So I reached out to him like over a month ago. He said that we really don't really understand how the brain works. So it's really a lot of things. So again, Dr. Gary Marcus, an expert in functional imaging, and we talked about how we really don't know like how the brain works.
Yeah, what was it that you told me, the breakdown of the brain between the unconscious mind and the conscious mind, the percentages?
Yeah. So the percentage of conscious mind is 5%. 1% is preconscious. 94% is unconscious. All bets are off.
Yeah, it's incredible to think about how
Yeah.
a massive part of our mind we is unconscious. Dr. Rashbaum, I really appreciate you coming on the Outworker.
All right.
I can't thank you enough for the work that you do, and the impact that you've had on me and all your other patients. And I know that you'll
Okay.
continue to be helping patients years to come down the line.
Okay, thank you very much for inviting me to your podcast. If a patient wants to see me in consultation, I have telemedicine privileges in New York, Connecticut, and Florida. I have a website, irarashbaumMD.com, irarashbaumMD.com. My office number at Rehabilitation, NYU Langone Health, is 212-263-6037. Thanks so much.
Thanks, Dr. Rashbaum. We hope you enjoyed this episode as much as we enjoyed bringing it to you. Whether you were informed or inspired, we're grateful for your time and attention. Remember, the conversation doesn't have to end here. Connect with us on Instagram at out.worker, subscribe to our YouTube channel, join our newsletter for more content, and share your thoughts and feedback with us. If you loved what you heard today, please consider sharing our podcast with your friends, leaving us a review, and subscribing so you never miss an episode. As always, a huge thank you to our incredible guests for sharing their wisdom and stories with us, and to you, our amazing listeners, for tuning in. We'll catch you in the next episode. So until next time, keep out working.